Assess the wound dimensions, including undermining or tunnels. Be sure to protect sensitive structures, vessels, and organs. Cut a thin or thick cover layer of foam to fill any tunnels and undermined areas that may be present. Then cut the wound contact layer as needed to cover the entire wound bed and gently place it in the wound. Remember, the Veraflo therapy foam must be sized and placed into the wound in direct contact with all surfaces of the wound. Cut either the thin or the thick cover layer as needed to fill the wound depth and gently place it in the wound on top of the wound contact layer. If the foam requires cutting, do not cut the foam over the wound. Apply the VAC Advanced Drape to cover the dressing and an additional 3 to 5 centimeters of intact skin. Pinch the drape and cut a 2.5 centimeter hole through it. The hole should be large enough to allow for removal of fluid and exudate. You do not need to cut into the foam. Next, remove the backing layers 1 and 2 from the SensorTrack pad. Place the SensorTrack pad opening directly over the hole. Be sure to position the tubing to allow for optimal flow. Pull the blue tab to remove the stabilization layer. Record the dressing change date and number of foam pieces used on the foam quantity label and place it in the patient record. It is important to also document on the dressing itself the date, your initials, and the number of foam pieces. Once the VAC Veraflo pad is in place, connect the VAC Veraflo tubing to the therapy unit. One tube connects to the canister for negative pressure and fluid removal. The other tube connects to the VAC Veralink cassette for fluid delivery. Now that your VAC Veraflo dressing is in place,